everybody, especially the pregnant expecting ladies. So today I am going to discuss briefly about gestational diabetes. It's the most common encountered comorbidity nowadays. So let's discuss in brief what all you need to know when you're pregnant and having gestational diabetes. So I am Dr. Poornima Gowda, a senior obstetrician and gynecologist practicing at Cloudnine Whitefield. Today I'll take you through the most important pointers of gestational diabetes. So what is gestational diabetes mellitus? So as the name suggests, if there is any sugar variation happening to a pregnant lady which is first time detected during pregnancy, it is called as gestational diabetes. So basically it can be a pre-existing diabetes which is detected first time, or after doing certain tests we get to know you are gestationally diabetic. So what does it mean to us? Why is it so important? So as we all know, we are in India, so basically it is a diabetic capital of the world. So if we see gestational diabetes across the globe, the incidence means how many people encounter this problem. It's around 8 to 10%. But we being Indians, we are somewhere between 10 to 25% of our pregnant ladies go through this issue. So why is it so common? Why are we encountering this nowadays? So basically, to start off with, it's the lifestyle we are leading nowadays. It's to do with the diet, the stress, no exercise, sedentary lifestyle. So these are all making people prone to become a pre-gestational. So then when they get pregnant, they encounter gestational diabetes. So in India, it's between 10 to 25%. So we prefer to start at preconceptional level to help people to diagnose it early so that we can deal with it better. So what are all the risk factors, or who are the people who should watch out for screening? So commonly nowadays we are also encountering women getting married late, so conceiving late. So after 30 years is when, which is one of the risk factor, and starting with a high body mass index. All of us know what is the body mass index. So if you're starting with a higher weight in the pre-pregnancy, that is also a risk factor. Having a strong family history, one of the parent or both the parents having diabetes, and if a pregnant woman is second time pregnant but in the first pregnancy she has had gestational diabetes, or any other comorbidities like having hypertension, polycystic ovarian syndrome, which is again one of the very common things we are encountering, which is also a lifestyle disorder. So these are all the common risk factors. So along with that, India itself belongs to any Asian women, they are high prone to have diabetes mellitus. So it is called as moderate risk for diabetes. So with this moderate risk, if you are having any of these risk factors which is already listed, so that makes you more propensous to have gestational diabetes. So now let us understand in detail about how do we go about in diagnosing gestational diabetes, what causes it. Now coming to the point, what causes it? So generally what happens in pregnancy, there is hormones which is produced by placenta. So these hormones are also known to act as insulin resistance. Insulin resistance in the sense, insulin is a hormone which is required for metabolizing all the glucose we eat. So these placental hormones are required to maintain pregnancy, but it also has an action of increasing the insulin resistance. So thereby the pregnant woman will encounter not able to break down all the glucose she is consuming. So that is when the glucose starts building up. And this is one of the important parameter which leads to gestational diabetes. See, other parameters like we have discussed with risk factors, if there is already a pre-existing genetic predisposition where family history is there, or there is other comorbidities like polycystic ovarian syndrome, they also have insulin resistance, or if there is any other medical problem like hypertension, or if the age of the woman is anything more than 30 or 35 years, so they could probably having a pre-gestational diabetes which is undetected. The moment they get pregnant, the hormones compound the effect and make it develop early. So how do we go about diagnosing this gestational diabetes? So in any other country, commonly the test screening is done only in the third trimester between 24 to 28 weeks because the incidence is very low. Because in India we are also seeing higher incidence, we start screening in the first trimester itself. So there are various tests available for screening it. Commonly people do a fasting blood sugar and HbA1c, but it gives us only a fair idea. But the actual diagnostic test is called as glucose challenge test. where a pregnant lady is given a certain amount of glucose water to drink, and post 1 hour the test is done to understand what are the values. So depending on the values and the cutoff, we diagnose gestational diabetes. So even though we diagnose it in the first trimester, we do not go about directly treating them. We educate them regarding the lifestyle modification and try to achieve a control by themselves. Only when it is not possible, they will be subjected to medicinal treatments. So now what is the levels? So commonly there are a lot of cutoffs and confusions existing in the especially in Google. So generally fasting sugar is only helpful in diagnosing pre-diabetes. So glucose challenge test is the most important single tool for detection. So following a glucose challenge test, if the value is exceeding anything above 140, that is when we call it as gestational diabetes. But anybody who is having a value of more than 200 will require a more treatment in terms of probably medication. But between 140 to 200, there's a lot of scope for correction of lifestyle, modifying one's diet, increasing the exercise, and probably close monitoring. The moment we are not able to achieve the control is when we consider treatment. So there are also people nowadays, the best time to detect it is probably pre-pregnancy. So because of the stress and the lifestyle involved, there is a concept of doing an annual health checkup. So there are many women who are yet to plan pregnancy, they do a test and their fasting sugars are borderline high, their HbA1c levels are already high. So there is a lot of concern and panic. So all you have to do is, that's an alert. You don't need to panic, because stress is also an important parameter which is making you from pre-diabetic to diabetic. So that is where alert, consult a specialist, modify your lifestyle, and the pre-diabetes is a stage where you can always do corrections and become normal. But once it is labeled as gestational diabetes, in pregnancy we have less scope, because the moment diagnosis is done, we don't have extensive time. The concern is to prevent the baby getting exposed to gestational diabetes and developing complications. So that is where we do close monitoring, we keep a lower cutoffs, and we start treatment at the earliest just to prevent complications. So what are the ways where one can attend to gestational diabetes? So basically it's categorized into two. One is where it is a borderline variation in the sugar level, where we can try to attain or achieve control exclusively by lifestyle, diet and exercise. So those are gestational diabetic type A1. The other people where the values of glucose challenge test is more than 200, and even after correcting diet and lifestyle, probably by a week, 4 weeks time, the values of sugar remains consistently high. That is when we start medicational treatment. So it can be either tablets which are available now or insulin therapy. So why do we want to treat gestational diabetes? So like we already know, there are certain things where genetics play a role here. So more than treating the pregnant lady, if a baby is consistently exposed to higher level sugars inside the womb, we call it as in utero exposure. There's a condition called Barthel's hypothesis. So how your baby is developing inside the womb will also decide the baby's future health. So that is when we want pregnant ladies to achieve a good control, so that baby develops into a healthy individual. Otherwise, the baby is constantly exposed to sugars, which may make the baby to develop diabetes earlier on in life. So this is a one major concern why in gestational diabetes we give a lot of importance to sugar levels. Even a minor modification of your diet and changes could lead a long way for both the pregnant lady and the developing baby. So now let's understand how to go about preventing gestational diabetes or managing it. So to start off with, how to prevent it. So start with pre-pregnancy. You can get certain blood tests done to see if the sugars are already high or if there is any modification which needs to be done. Nevertheless, you can always start with a healthy lifestyle. Healthy mind and healthy body. These are two important things to carry a pregnancy without any complications or any problems. So which includes lifestyle modification. So the first thing is avoid stress. Avoid seeking too much information. Avoid stress. Start following a healthy diet routine. So healthy diet, when I say, basically it is managing the quality and the quantity of food. So having a balanced meal which is low on carbohydrate and high in protein, and also adequate fiber in your diet like fruits, vegetables, it becomes very relevant. And always target 30 to 40 minutes of moderate exercise. Even when you are pregnant, this is allowed. The simplest can be a brisk walk. And also, most important is, so this starting with a healthy lifestyle also prevents many things apart from gestational diabetes. But what to do once the diabetes is already developed? So if it is in a mild to moderate range, the same thing holds good. The diet modification, exercise holds good, and monitor it. The moment it is not manageable, that is when you need to seek a proper diet chart, dietitian advice, and then with that also you need medicinal therapy. Why do we target medicinal therapy? Is basically to avoid complications to the mother and the baby. So with this, you can have a safe and a smooth journey. Thank you.